All right, so what you're going to do for the AC joints, this is so easy, 72 SID, crosswise. So what you're gonna do is aim for, see where my line is? It's right at the AC joints. Can you see that level? On each side. So that's the level that you want to be at. Because you're going straight across the level of the clavicles. Then all you have to do is match the IR now. Okay? So I'm going to pull your head back and twist it. Put your head right against that. Thank you. Okay, so here's your ACs. Let me go ahead and get this again. All right, there's your, oh, right there. Sorry, Jude. Okay. Right side. Left side, both markers, okay? So now what we're doing, the hands are gonna go by their side. I personally do it neutral position, just like that, because when they hold it down, it's gonna be fine. All right? Now you're gonna just collimate here. This is all you need. Okay? All right, so you're gonna have the patient here, making sure that their back is against the board, the coronal plane is running parallel. So I'm looking here, and I'm looking here. So I'm feeling for the shoulder from the distance on both sides with my fingers to the IR. Expiration, shoot your picture. The second one is going to be with weights. Now you're gonna feel the difference here. Put these at your wrist. Okay, now grab them here, down on the bottom with your hands. All right, palms down. Now, okay, take a breath in, blow it out, let your shoulders take with weights. You take the same image. There's no difference. Then you come over here and grab the weights from them so they can relax. So they're about 5 to 10 pounds each. And with someone that's been lifting weights, and they're the ones who tore their ligaments, that's what happens. They either got the dumbbells really quickly, or they do overheads, and it's too much for them. They start ripping everything. So you're going to get a lot of bodybuilders. And unfortunately, when you get those guys in here, you've got a lot of muscle mass. There goes the mass, there goes the KV. So you're going to get that often. Any questions on that? Okay, so we will do AP shoulder. Okay, left or right. Let's so everyone can see right side. All right. Okay. Right, back against the board for me there. 40 SID. One more time. Okay, so where's your measurement supposed to be? You're centering where?
Which one are you doing? Is it
AP, just the AP shoulder.
AP shoulder?
2 inches inferior and 2 inches medial.
1 inch inferior. Okay, come towards me. Okay. All right. Now this is your pars plate right there. See that? I'm going to get yours. I've already done them. Okay, so you're going to follow here's your AC. You're going to go down anteriorly. And there you are, right there.
Hi, thank you.
Oh yeah, I got it.
That's your little bone. That's your nubbin.
Huh?
You get that?
Yeah.
Okay, so when you're doing that,
Right
you're
here?
palpating. Yeah, right there. This bone is the one that you want to palpate for. Inch inferior is going to be your center.
Huh?
Okay? Right where I'm at. All right. So when you have it like this, like they were talking about earlier, primarily what you're going to do at clinic is you're going to center this a little bit more because you want to include half of the manubrium in there. Because that's what they want to see. They want to see the entire thing. For your practical, you're going to center
At the nubbin.
oh, it's, you know, you're right, near the nubbin. Yeah, pretty much at the nubbin. I don't understand what was going on earlier, but anyway.
Just for proportion.
Okay, so AP is slightly abducted, just slightly. You don't have to, it's not against the arm, just slightly abducted. Palm forward. Okay, inspiration and expiration.
Expiration.
Expiration. Good. Okay, neutral. Okay, internal rotation, back of the hand. Can you rotate it more? There you go.
Oh, like that.
Yep, that's internal back of the hand against the thigh. Okay? That's it. Okay, external is your normal anatomical position,
Yes.
and that's your epicondyles running parallel.
Yep.
That's why you abduct it more, because they can't rotate it when it's close to their body. If you pull it out a little bit more, your epicondyles are running parallel. If it's neutral, you're forming a 45-degree angle with your epicondyles. If you have it backhand, internally rotated, you're perpendicular. Okay? Make sense?
Yep.
Sweet. All right. Collarbone. Okay? Your clavicle, you're going to palpate for the AC joint, palpate for the jugular notch. Right here. Okay? You're going to get the halfway point, and that's where you're centering. Easy enough, right? Because that's each end point joint, right? Your sternal extremity and your acromial extremity. The middle of that is the midpoint of your shaft. That's all you need to center is right there. Okay? Now you're going to collimate to the body part,
This is
but you
just
need soft tissue.
AP clavicle you're doing right now. Right? Okay.
That's correct.
Okay.
So this is your straight AP clavicle. Internal, exhale or inhale?
Exhale.
Exhale, because you want the contrast. Okay? Now, if you're going to do a lordotic, and if the patient's able to arch enough, you could do a perpendicular CR. Okay? And this one is inhale, because you want the clavicle to rise.
When they're doing the lordotic.
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 You inhale, because the chest is rounded, correct? If you raise it, does your clavicle go up or down? Goes up?
Yep.
Kind of up, yeah.
It goes up. Okay? So you're going to step about a foot away from the board. This part is going to touch the board, so you're going to arch here. Okay. You're going to palpate for the clavicle. If the clavicle goes straight across, you've got perpendicular CR. And I'm just going to go slightly up for her, because now her clavicle, this is her clavicle, is up here.
What did it look like before you moved it to? Okay.
This is her clavicle here.
Can my shoulders be back on neck now?
Actually, it should be the top. Yeah, you can put your neck right here. This part right here should touch. Right here.
Like that?
Uh-huh. Now here's the clavicle. Look, she's straight across here.
So the prominence should touch, right?
The prominence. That's a good idea. So if this is straight on like that, she is over. That is a perpendicular. Because if I could feel it, you could feel her clavicle. Her clavicle is here and it's over the ribs.
Right.
Okay? Okay, come on up carefully. Now, if you're going to do an AP on her and she doesn't have that, the ability to go, so it's going to be 15 to 30 degrees, right? So what I'm going to try to do is I'm going to match this to see how much I need to bring it down. Okay? So I'm going to go about there. See, on both shoulders. See the difference? So all you have to do is kind of angle up to see how much movement is going to happen from one plane to the other.
He should be in the model.
Sure. You can get him in if you'd like.
I can't see anything. It's fine.
Yes, you can. There's
What?
always a nice way to say it.
No, I said I can't see anything. I hate being the model, but it's fine.
Okay. So that's exactly what you need to do to switch over. Does anybody else want to switch so she can
Do
see?
you want to see it?
It's fine, it's fine, it's fine.
I would do, but my shoulders are killing me already. I'm so sorry.
I'm happy to do it if you want to see
It's
it.
good.
Okay. So what else is left? The superior and inferior, inferior and superior, correct? So, but I think what did I include on yours?
There's the orange.
Also the scapula.
Yeah.
All you're going to do is make the patient do a stop sign. That's all you're going to do. Okay? You're going to feel already the scapula is going to come out here, the lateral border. And here's the top. So all you have to do is center 2 and 2, right? So your scapula is right there. So I'm gonna center there. Side step towards your right, please. With more right there. Okay, inferior border, I'm feeling for the inferior border and she's there. So I have to make sure I include that. She's going to go there. Okay? Because here's her neck of her scapula. So here's her head here. So the neck is here. So we're going to move more to this, a little bit more right there. Okay? Now if you have her shoulder here, you can have the patient hold very still and you're going to ask them to take a breath in. Slowly blow your breath out, nice and slow. So you notice her shoulder moves. So this breathing technique is not going to work for her. So what you can do for her is just tell her to just go puff. Tell her to say the word puff.
Okay.
So puff. Okay.
Puff.
So let her hold really still. Tell her to hold her back against the board. I'm going to go take a picture. What I need you to do is say puff when I tell you. So say puff. Shoulder didn't move, but her ribs did. Okay? Easy enough? Okay, relax.
I'll sit inside.
Okay. Yeah, because puff is enough that the ribs go like that. So it blurs it. So if they start making fun of you, they'll call you the magic dragon, but I don't know which generation's gonna understand that one. Okay. All right, so that's your scapula. Now the why. The why.
Yeah.
I'll take a pause.